Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another rarely asked question. So what should we do about the current opioid crisis? So in this question, actually it's a little difficult to answer. And actually the interviewer asked us about this question because they want to know that at least we know something about the United States healthcare system. We know there are social problems, so they just want to see if we have an idea about that, and so definitely we need to know what's behind that. What's the role of the government, and what kind of policy will influence this opioid crisis, and what's the role of a hospital in this problem, and what can our doctors do for this problem. So my suggestion is to just focus on one point. Well, because we are applying for the residency programs, so my suggestion is to focus on the doctor's role for this problem, which is more related to our future work. So, so here's my example for this answer. Okay, so Dr. Cui, so can you tell me a little bit of your opinion of the opioid crisis in the United States? Yeah, of course. So actually, the opioid crisis is one of the common social problems in the United States, and also it's also one of the biggest problems in the United States. I would say that a lot of things would affect this problem, including the policy of made by the government, and how would the hospital uh, manage the patient, monitor the patient, and what's the policy in the hospital, and also what's the role of, and also the role of doctors also play an important role in to solve this problem in these problems. So what I can see is that as a doctor, so we just try our best to give our the patient the best treatment, best management, and by using those painkillers, we should be very careful. Just follow the guidelines, follow the rules, and also use the most use the non-opioid medication first if the patient has a pain, like NSAIDs or any other or acetaminophen to first in order to control their pain. If it cannot control very well, so then we may consider about those opioid medication later. So my point is just try our best to be to our best to help our patients, and always follow the guideline, and to treat the patient who has a pain. Um, so that's my point. I hope my answer will help you for this question. So actually, I just mentioned all of three factors would affect this problem, and the government's role, hospital role, doctor's role, and and then later on, I just focus on the doctor's role for this problem, and also I mentioned that what we can do is just try our best to help our patient follow the rules, and also how to use the painkillers based on the different levels of the patient, and just step by step using those opioid medications if it's really necessary. So and then I just summarize that the role of the doctor, what we can do to for this problem, and I hope you can also get something from my answer, and good luck.